I'm Sasha Nicole.
And I'm Star.
And I'm Dr. T.
And this is Amerikan Therapy, the definitive podcast on all things Black mental health. And super, super excited today. We have a different show, one that you might not think has anything to do with mental health, but it does. So Star, what are we talking about?
Y'all ain't ready for this. Okay, so we know the chiclet teeth, the yellow teeth, all that stuff, right? But we're going to talk about beyond just aesthetics, right? I need to go to the dentist too, so I'm going to holler at y'all afterwards, all right? But we're going to talk about dentistry and its impact on our mental health. You heard that right, dentistry and its impact on our mental health. I have no idea where this is going.
All right, so to get started, we have two phenomenal guests today. We have Dr. Kristen Millender, who is a general dentist and collaborative entrepreneur in the cannabis industry. She earned her BA in chemistry from Virginia Commonwealth University in Richmond, Virginia, her master's in biomedical sciences from Barry University in Miami, and her doctorate of dental surgery from the University of Maryland in Baltimore. Her passion is multifold as she works to treat patients holistically with a focus, integrative and preventative treatment. Dr. Millender's goal is to incorporate cannabis therapy into the dental profession and provide alternative and natural ways to help people, especially African Americans. And then we have Dr. Don Clark. Dr. Don Clark has a professional portfolio that includes general dentistry and treating patients who suffer from debilitating mental illness. She earned her BS in biology from Towson University and her Doctorate of Dental Surgery from University of Maryland in Baltimore. Dr. Clark completed her advanced education at St. Elizabeth's Hospital, the only general practice residency program based at an inpatient psychiatric hospital. And while at St. Elizabeth's Hospital, she became the principal investigator for a case study evaluating dental anxiety on individuals in care. So I know somebody who went to St. E's actually. So if y'all don't know, we're based in DC. So for all those listening who are not from the DMV area, St. Elizabeth is a pretty well-known psychiatric hospital in DC. And it was always like, it's not a joke at all, but it was
it's
like,
first, right? It's like the first federal psychiatric hospital, or no? Dr. T is like, no.
I mean, it was very early though. It was very, very early.
Yeah.
The top 5, like very, very early.
Yeah. So, when we were first thinking about the show, it was like, and I remember I looked up some stuff prior to this show, like dentistry and mental health, like trying to put it together, not even realizing how big this is actually a big deal. So, so just
connect the dots. Because I'm like, still like, okay, my teeth and my brain, they close, but I don't know how they connect.
Yeah, it's all integrated. There's so many, like the umbrella is pretty big. So we have the issues with people who have dental anxiety and dental phobia. And there's a lot. I think like over 70% of the American population has some type of dental fear or dental phobia. Well, dental fear. So we have that, but then we have, a certain population that has mental disorders or psychotropic disorders, and they are prone or at higher risk for certain dental diseases. So like Bruxism, where people grind their teeth and wear their teeth down. Children with ADHD are at risk for that. I can't tell you how many times I've had patients come into the office and ADHD can cause it. The medication for ADHD can cause it. So we see that. And then what else, Dr. Clark? We see the dentist having to deal with keeping our mental, health sane as well. I mean, it's just so connected. And then you have, just certain comorbidities. So if you have like someone who's dealing with depression, a lot of times, they will avoid coming to the dentist. Yeah. And what that winds up falling into or turning into is maybe periodontal disease down the line. They lose their teeth. They have less functioning in their teeth, and it becomes a digestive issue then at that time. And so it's a cycle.
Yeah.
But what causes that? Because like I grind my teeth. Now I feel like I'm at the dentist's office. I found out like 5-6 years ago I grind my teeth when I sleep. Like what is the truth? Like, what's making that I mean, I know it's ain't
crazy.
I mean, yeah.
Dr. Clark, you wanna pick up on this, or you want me to go ahead?
Well, I was gonna say with bruxism, which is grinding or clenching your teeth, a lot of people do tend to do that at nighttime, and a lot of people aren't necessarily consciously aware of it. As far as like the research goes, there's been a lot of things, I guess, that have been potential to cause bruxism and clenching and unconscious grinding. However, most of what we're led to believe is probably stress induced. Chris, I don't know if you want
to most definitely. It's mostly stress induced. So you have a joint called your TMJ, your temporomandibular joint, and then you have like the muscles in the mouth. And so when we're tense or we're stressed, just think about the day, like not even when you're sleeping, when you're stressed, when you're tense, your muscles are tensed up, right? And so when you're sleeping, you're doing the same thing. And we have a huge muscle in our jaw called the masseter, and it carries a lot of force. And so when we're sleeping and we're under stress and our body is tense like that, we're literally clenching our teeth like this. Some people under stress will clench their fists, but it's just a stress-induced, behavioral disorder. It really is what it is.
Yeah, and a lot of what we were saying is, it takes place in your sleep. So especially if you have, a significant other, someone that you sleep with, that you should be asking them like, hey, do I make any like clenching sounds, any grinding sounds? Because there are very audible sounds. I've heard them before with people that clench and grind at night, and it does kind of make you,
cringe a little bit.
But that's, an indication that, the person needs to go in, see a dentist, and potentially get something like a mouth guard to protect the teeth from just constantly that friction just shredding together.
Yeah, some people will wear it all the way down.
A lot of people with tooth wear asanies.
So two things with you saying that. Well, one, my first question and then a comment. Is it possible that, because I've noticed when even when I'm not asleep, if there's something like that I'm thinking about, or when I have to take a lot of pictures, I have this tendency where I clench really hard on one side of my mouth as opposed to the other. And then I can see it in a picture actually where I'm doing it because it inverts my mouth. Is it possible that even during the daytime that as people, if we're stressed, we can do the same thing with our teeth and not even know it? And then two, just a comment, just being very, very vulnerable. When I'm really depressed, or where even like if I'm in a state where like it just isn't good for me, brushing and flossing my teeth is usually the last thing that I do. Mm-hmm. Like, and it's not because like I don't want to, or like I want my teeth to fall out. It just like, hell, sometimes I don't even want, it's like, I like being clean. I want to take a shower, but like, I want to be clear. But it's like, I can't do it. I don't have the strength to do it. I don't think about it. I don't feel like it. And when I get out of that place, one of the first things that I do is actually brush my teeth. Like,
I'm going to answer your last question first, since it's the most fresh in my head, and then we might have to go back to the first one. But brushing and flossing is really not the first thing on anybody's mind. And you really have to find ways to make it kind of like a habit. And what I normally recommend to my patients is finding a new tool that they can use in between their teeth to clean. And we can kind of go over some of those. I won't go over those now, but kind of creating a new habit, or putting the floss next to your, like on your night table next to your bed, or putting it in your glove compartment in the car, and just being aware of it, because it's not the first thing. And a lot of times people in our community, we kind of tend to live in survival mode. We kind of focus on what's right now, what's in front of us. And that constant stress honestly keeps us in a fight or flight kind of mode. We're not thinking about our teeth. And honestly, that's probably one of the biggest reasons why, we have so much to deal with. It's not the first thing on our minds. We tend not to see the dentist as often as, Caucasians. Of course, there's access issues and all other types of things too, and dental trauma and blah, blah, blah. But, it's not the first thing on our minds. And when people are depressed, they don't really want to do things that necessarily make them feel better at that moment, right? Like it's kind of like wallowing in that. So it's not going to be the first thing on your mind. The best thing to do is just have it close, accessible, and be aware of it, because it's really important. And then just educate yourself on what happens when you don't do it.
Dr. T, what was you going to say? Chime in here on like that.
Yeah,
mental
I was
capacity.
going to just say, agree with you, Sasha, and Dr. Chris, that, you know, when people have any kind of emotional issue, it doesn't have to be a diagnosable depression or anxiety disorder, or any other kind of, you know, because we oftentimes think of the most severe people like those in St. Elizabeth's, but everyday people and just our everyday mood fluctuates our interest in our own self, our interest in self-care.
Yeah.
And it's this very weird reciprocal or inverse relationship where if you feel bad, you don't want to smile, but then if you don't take care of your teeth, you don't want to smile. And so it almost piles on itself. And that's leaving out all the other stuff that the ladies talked about, people's fear about going to the dentist and fear of pain. So it's like, if you don't feel good about yourself, if you know you haven't had the time or the energy or the interest to take care of your teeth, or if you're even having issues, like it's very, very true, our teeth digest, it's a large part of our digestive system. So if you aren't taking care of your teeth, then you're not getting the nutrients you need. So then your mood can be affected. And it's like this vicious cycle that people have a hard time breaking. And then, of course, the further you get away from the dentist, the harder it is to go back. Right? So it is a real issue that is not just in the most severely mentally ill. It's in each and, you know, everyday people with everyday worries and everyday anxieties.
Right.
That's one thing, like my doctor, my therapist has always said, like that's what been on my wellness plan for years. Like when I don't want to take care, my hygiene starts to lag. Like, oh, I don't need a shower today, or oh, I don't need to brush my teeth today. That's always like a sign for me dealing with chronic depression of like, oh, I'm slipping into the black hole. So right. Let me go get a tune-up.
Right, and I will even add, there are so many people that I've seen, some patients that have come in who are so happy that it's mask season because of COVID, because they don't necessarily have to smile if they're not happy with their smile. And it just goes to show you how deep that really, you know, is with feeling, even connecting, like feeling good about yourself, and some people who struggle with depression and their smile and things like that. Like it really does affect very deeply.
Yeah, because it's funny because oftentimes you'll like people will be like, oh, why you never smile in your pictures? And I don't think that like my teeth are jacked, like I don't have some jacked teeth, but I think they're like too little.
Like, how do you know when you have like some body dysmorphia, or it's like, no, your teeth is fucked up and like you might need to get that. How do you know that? Like,
well, Dr. Chris and I talk a lot about, you know, the
is that an official diagnosis? Y'all be like, yo, your teeth is fucked up.
You jacked up.
I'm sorry.
So I was gonna say, understanding the mental health behind the smile is often what leads people to perceive that their smile should be a certain way among, you know, all the images that we're flooded with in the media, especially, you know, if like my sister, for example, she's also a dentist. She has a diastema, but for a long time, you know,
What's that?
A space between your teeth.
Oh.
Yeah.
Yeah, okay. Oh yeah, you do have a diastema. See, it's so beautiful. I didn't even know. So just understanding that your smile is beautiful, but what we do as dentists, we want to make sure that it's free from decay, free from disease. You know, we're more concerned about, you know, the health behind the smile rather than the smile being, you know, perfectly pearly white and everything is straight. There's more to, you know, a smile than just the aesthetics of the smile, if you understand where I'm coming from there.
Yeah, and even like the characteristics of a smile. I mean, I think we try not to call them gaps because of the bad connotation that comes with it. But diastemas are completely healthy, and they do add character to a smile. And, you know, you ever see Gucci Man? Oh my God, his teeth, he has like all crowns. His teeth are like like really, really white. And they,
Big.
excuse me, I hope I don't, you know, they don't look good. You know what I'm saying? They just, they just look fake to me.
I don't want no smoke, Gucci. American Therapy don't want no smoke.
No smoke, yes, none of that. But like there's just so much more character. And like Dr. Clark said, when we're bombarded with how images are, like how the smile is supposed to look, you got to remember there's also like, you know, the most aesthetic nose angle and like that angle between the base of your nose and your top lip, and then like your cheekbones and all of that, that's based on characteristics of a group of people that we don't share common features with. So, you know, it's important to kind of self-identify what, you know, your natural smile looks like. And there's nothing wrong with wanting to go and get some aesthetic work done, because there is aesthetic dentistry and they can, you know, do so much for you. And it's all measurements. It's all measurements at the end of the day. It's all numbers. And, you know, you can always try it. But to kind of go back to something you said, Sash, about small teeth. To change, like sometimes it's a millimeter to 1.5 millimeters. That's really what dentists work with, is in increments of millimeters. And there's a very thin line between when something looks aesthetic and when something looks completely off. And it can be it can be as small as 1 millimeter off, and it will look completely different. So even kind of reshaping the way the smile is a very, very discreet, I feel like, procedure. And you just always really want to be careful with it. There are some diseases where people have smaller teeth, they're born with smaller teeth. Some people have peg laterals, which is like a really tiny little tooth next to your middle teeth in the front, and it can be really, really small. Some people have that.
I hate when I see that, especially celebrities. I'm like, get that fixed. I'm sorry.
Yeah, some people have gummy smiles, you know, like, you know, and you can get that, you know, taken down too and have a more aesthetic smile. So there's a lot that can be done, but your smile is beautiful. All of your smile is beautiful.
Well, speaking of that, Dr. Clark, can you share what it was like being an investigator and dentist in St. Elizabeth? Because for the people where it's like, okay, we can normally and naturally talk about, we have access to dentistry and mm-hmm. care. But for those people who might really be struggling with a very severe mental illness, or have a family member with a severe mental illness, like, you know, what is that like? And this isn't to sound like silly, but like, how can, like, when you were there, does is helping to fix their teeth, can it also help impact the disorder that they're going through? Does that make sense? I don't know.
Oh yeah, definitely. And I think also my class in particular, and I could just be biased, but I think the group of residents that I went through the program with were just amazing clinicians and amazing people. And I felt connected with the patients there. So even starting, having a, you know, solid foundation of a relationship with your dentist is important to foster any change, because, you know, we're the ones that are doing the treatment. You know, you're the ones that are accepting the treatment. So if there isn't a trust initially established there, then we're not going to go very far. So a lot of the patients that I saw at St. Elizabeth's just didn't have that initial trust piece. And so it took time to work with a lot of them to just get to starting to do just very even simple stuff. So once you kind of complete a procedure, you know, you have to walk them through the treatment plan and always be reminding them of what's coming up next. What do they have done? Let them see what's been done. Let them see themselves transforming, and you do see their attitudes, you know, start to improve as they see that their work is being done, and that they can establish trust with you, and that you're there to help them, not necessarily, you know, inflict pain or anything, that you're there as a support.
Yeah.
Yeah, and just to add on to that, because people develop relationships with their mental health providers, particularly in the community, there has been a trend in recent years where schools of dentistry are partnering with mental health centers and working, because that is a way where those people may not go other places to get care, but they trust what's happening at their mental health center and they will accept treatment there. So there's been more and more partnerships between primary care providers and dental providers with community mental health centers, and some of the state departments of public health are helping fund it. So people are understanding more and more, like we started out this episode talking about the relationship and the correlation, and trying to figure out how to get people who need help and who might otherwise be leery of help to get access to that help.
I definitely agree. I was going to add, in starting the research project, which is still currently ongoing and kind of pushed off a little bit because of COVID, it really helped to have that relationship with the patient, because now I'm coming to them. It's a case study based research project. I'm asking them to participate, in my study versus there's tons of other clinicians within St. E's. You have psychologists, psychiatrists, music therapy, and, everybody's trying to do research here and there as well. But, it just really meant something that, a lot of the patients were accepting to even, be willing to participate in the study, because dental anxiety as it pertains to inpatient mentally ill individuals, there's very, very little research in the United States. And globally, there's very little research as well. So it's kind of, unique to kind of be at the forefront of finally understanding some of these things that affects pretty much, everybody. Everybody knows somebody that has some kind of dental anxiety or dental phobia.
So if you suffer from dental anxiety, or like you have like a diagnosis, like I have diagnosed depression and anxiety disorders, like what do you do when you're looking for a new dentist? What should you be asking? Should you tell them like your mental health diagnosis? Is there things are there things that they can do to make it like a calmer visit, or, help you out?
Yeah, so definitely something you should disclose to your dentist if you do have dental anxiety or a dental phobia, because we want to know, we don't want to come at you in a way that would offend you or a way that would scare you away. Right, so that would typically be covered when we kind of cover medical history. But a lot of patients are kind of vocal about that, like, I'm afraid of needles. That's usually the indicator that I hear. But in terms of what can be done, we can use like things like aromatherapy to music therapy to dance therapy.
In the dentist office, you can do that?
Oh my goodness.
Can I smoke weed before I get my teeth done?
Listen, that's a fair question. Can you get high before you come to the dentist? Seriously.
Good question.
Yeah. And so while at Maryland, Dr. Clark probably has the same experience. We're probably situated in Baltimore in a population that heavily consumes cannabis. And so I've had situations where people come in and they've smoked right before they sit in the dental chair. They come in loud, like you can smell it and everything. And actually it's kind of inhibited the anesthesia from working. So either they're not getting numb enough, or it wears, or actually what happens is it causes it to metabolize faster. And so it wears off very fast. And then that winds up being an uncomfortable procedure because you have to continue to give injections. Me and Dr. Clark are really big on the CBD side of cannabis. And CBD is being considered an anxiolytic at this time, which means it does reduce anxiety, specifically more so general anxiety disorder. But there is some anecdotal research to show that it's helping also with dental anxiety as well. So that's kind of where we are kind of headed in our profession, is trying to incorporate that, because it's also a much milder medication. Well, it's not considered medication yet, but it's a much milder therapeutic that you can use. But you can also ask, because dentistry is a little slow in that regard, and it's not going to be everywhere, so that might not be practical for you, right? So you can also ask for nitrous gas, which is will bring down the anxiety, and you can drive home right after that. It wears off very fast. You can ask for something a bit more strong, like a Valium or something like that, or some type of sedative.
So you have the right to say, like, before you get the needle, like you can say to the dentist, because these are things I didn't know. I just be in the chair crying and shit, like,
oh no, honey.
Like you can say to the dentist, hey, I want nitrous gas, or hey, I want you to give me something for this anxiety.
Yes, and as a matter of fact, I would encourage everyone, like Dr. Clark said, we do ask during our medical history, but every office is different. Maybe they don't ask if you've had a past traumatic experience or at the dental office and blah, blah, blah. But we do, and we would offer something like that, because if you come in like pre-operational anxiety, if you have anxiety before you come in, chances are you're going to have anxiety throughout the procedure. And the outcome of the procedure is going to be poorer. Right? All the way to the point where if you're so anxious, you can completely override the anesthesia from working as well, because everything starts in the mind. Yeah. So, like, we definitely need to be able to accommodate any anxiety that you have. And that can be through nitrous gas or laughing gas. That can be through a sedative, like I said. That can be through more of a behavioral thing. What I do with my patients is breathing exercises before we start. I don't even offer like the sedative and nitrous at first, because I feel like the less, the better. And we need to start training ourselves to use ourselves, because we can, in many cases, overcome certain things just through our minds. I do believe. So, those breathing exercises, oh my goodness, they work like crazy. We can do other things. We have tricks to help with distracting the mind while we're giving an anesthesia. These are all things that I think a good dentist, I will say a good dentist will practice, because your experience is going to dictate whether you are likely to come back and continue your treatment.
So speaking of good dentists, what should we be looking for in trying to identify a good dentist?
Ooh, we got a whole list. Dr. Clark, you want to start?
Well, before you do that, can I just add one thing to what Dr. Chris was saying? Just because there are lots of options, but finances can be a prohibitor for people. Many insurances do not cover those things that would make us comfortable, which is why people don't ask for them or have refused them in the past, because you can get nitrous oxide, but then you have to pay. Your insurance is not going to cover it. And oftentimes it might be the Valium or lorazepam or something like that is an oral sedative. So you need to take that to the pharmacy and take that either on your way to the dentist office. So there are definitely workarounds, but for some people, finances is a rate limiting factor as well.
So we need to talk to the dentist prior to even the visit and like start that conversation of like, I have chronic anxiety, blah, blah, blah. I got you.
Well, at your first appointment, when you're going over your medical history, be very, we as patients, we need to start talking more to our medical providers and letting them know what's going on in our mind, not worrying about how it sounds when it comes out, like, so we can have the conversation, you know what I'm saying? So tell them as much as you can that's going to, how, if it's going to impact the care and your comfort and how comfortable you are.
Okay, so the list of what we should be looking for and trying to identify a good dentist.
Yeah, yes. I would start with, the office itself, because usually the first experience you have may not be with the dentist. It might be with like the office staff or with the hygienist even. So just seeing your interactions with the staff, with even the space, is everything kept clean, things that sometimes you just kind of, turn your head to, like really pay attention, because especially, now with coronavirus, like protective equipment and making sure everything has been, clean is definitely something that you should be paying attention to. And, it is okay to ask like, hey, has this been, wiped down? Is this clean? Just making sure you're staying protected. Again, what Dr. Chris was saying, being vocal for your own, being. And then also, us as the clinician or us as the dentist, making sure that we communicate to you what your treatment is, making sure that you understand what it is, because oftentimes your doctors can start throwing around periodontitis and 10-letter words and you kind of just, your head spinning, but making sure that you understand, what you're actually having done to your, for your treatment.
Yeah, definitely a great dentist is also, in my opinion, an educator. And I think that goes for any clinician. We should be able to explain it to you in a way that it makes sense. And you should be able to follow and actually kind of repeat it back to us to make sure that you understand. Because we're going to make sure we give you that informed consent, form and have you sign and say that you understand. So, when you read that, you want to really say, do I feel comfortable with this? Was it really explained? Do I understand? Can I go and get a second opinion and be able to follow that conversation with another dentist. That's what I do with all my patients. Even if they don't come back to me, I want you to be able to go to, if you decide to go to another dentist at any point in your life, I want you to be able to follow the conversation. So I'm going to educate you on what's going on, not just tell you what type of treatment you need.
You know what the thing that gets me though about the dentist office, and this is just my pet peeve, right? It's like, well, two things. So the first thing is like, you know how after they clean your teeth and the ladies or the lady or man, because you know, it's 2020, cleans your teeth, and then the dentist comes in for like 5-10 minutes, and then they do the like C1, 9 like molars, and it's like, what the fuck is y'all talking about? And I'm sitting there already having a panic attack. Now y'all having some like, and I know the way they talking, that like problem, okay.
It'd be like Jiffy Lube.
Yes.
Number 4, OD.
Yes.
Number 8, OU.
It's like, yo, you see me over here sweating already. Like, y'all gotta stop that.
That is why we should explain. So anytime I'm doing like a gum exam and I'm calling out numbers, right? I say, I'm checking the gum tissue or the collar of gum tissue around each tooth. The deeper the pocket, that means that there may be some infection there, and it's going to be a higher number because that's how many millimeters deep it is. And so I explain to them, 1, 2, 3s are generally good numbers. Anything higher, we start to see gum disease. And so I'll call it out. And we just have to be, as clinicians, just aware that some of these things sound really scary. Even in diagnostic terms, sounds scary. You know, you don't want to
do an oral cancer exam.
Right, when you do an oral cancer screening, you're calling things out to your assistant. Like, you know, people are like, well, what is that? You know, so, you know, we have to be mindful. And sometimes that information is good to kind of present at the end so that your anxiety is not increasing by the time you're ready to run out the door, you know?
Then the hygienist is shaming people. Oh, I see you don't floss. Bitch, you know I don't floss. You know I didn't floss when I walked in here. So don't do that. Don't do that today.
And it's funny, you know, because some people actually don't want to know they don't want to know about it. You know, like sometimes I have to say, are you someone who do you want me to explain the information to you, or do you kind of just want to know the basics and what you need to do? And you have people that go both ways, but it's important to have that communication. And again, goes back to what you should look for in a good dentist is someone who's going to communicate with you.
Dr. T, is there anything you would add here in terms of like how we can prepare ourselves mentally more and just, you know, like we said in the beginning, like we never really, I say we, but I mean, you a doctor, you probably knew, but like the correlation and how this all plays a part.
I mean, I think that the same thing that the ladies have been talking about is the way we are with all healthcare professionals. We approach it almost with a sense of shame and embarrassment because we know we haven't been doing what we should have been doing. And so we're entering it in a imbalanced relationship. And all good clinicians, dentists, doctors, therapists, they want to have a healthy, balanced relationship with you, but you're coming in from such a place of feeling inferior because of the behaviors and actions that led you to coming there in the first place. So it really is, Sasha, for us to recognize that the people are there to help us because they want to help us. Like there's nobody that goes into dentistry because they like to be in your mouth, right? They want to help you. They are there because they want to help you. Every clinician goes into their field because they want to help you. So if we could just remember that, then we could kind of reframe our mindset and then approach it maybe in a little bit healthier way so we can be a little more calm, a little less anxious. Everything that we're talking about is behavior based. And, you know, we know that the hardest thing to change is a person's behavior, but shows like ours and conversations like this, at least get people to start to think about the behaviors. So then they have an opportunity to change them. So you can't make these kind of changes overnight, but getting some new information, thinking about it from a different way can really help you approach it and then have a better conversation and have better dental health and have better mental health.
Yeah, definitely.
I guess as we begin to close out, Dr. Chris, Dr. Clark, if there's like anything you want to add, where your office is located, and then maybe if there's any like part you want to touch on in terms of, because I know, Dr. Chris, you're very interested in the impact with Black people and dentistry. As we know, I know growing up, I never remember Black people talking about going to the dentist. Like nobody ever talked about going to the dentist. It wasn't until I became an adult that even I think the one time my father was, I had to get my wisdom teeth removed. Like we go to the dentist, oh, it's something wrong.
Yes.
but
yeah.
but not on like a dentist has not become a regular part of our occurrence a lot of times in our communities. So if you could also just touch on that real briefly too as we close out.
Part of that has a lot to do with what Doc had mentioned earlier about money. So people think that the dentist is more expensive than going to like a physician, when really it's that the insurance doesn't cover as much. So if you have dental insurance, it doesn't cover as much. You still can have a pretty hefty copay. And when people hear those numbers, they're like, okay, to save a tooth can cost over $1,000. To extract it, to take a tooth out can cost $80. So if money is an issue, they're gonna have the tooth taken out, and that can be an even more traumatic experience. And so if us as a community, if we are more so used to having our teeth removed, which I can tell you, the majority of the patients that I see in our community have had several, have had their fair share of teeth removed, then your only experience is having something taken from you or out of you, and you're not necessarily eager to really go back. But then another thing is we're not really represented that well in dentistry. Less than 3% of dentists are African American, so in the whole country. And so it's not a lot of us. And so just as you guys talk on your other podcasts about just being able to identify with your mental health provider and so on and so forth, that's important with dentistry too, because there is a certain trust factor, and we can identify, there are certain anatomical differences between our people and other races. And it's like, if you can identify, understand that, you may be less likely to treatment plan something. You know what I'm saying? So those are things that kind of all like affect us and our experiences. And then we just learn behavior. If our parents, we now say, the American Dental Association says to bring your child to the dentist when they're 6 months old. We ain't doing much with your child when they're 6 months old, but it's the experience. They're used to it. That experience gets imprinted. Even if you bring the siblings to the visit and they can see that it's not hurtful, it's not harmful. If a child is coming with their parent to the dentist and they're sitting there, because a lot of times people in our community have to bring their children sometimes to certain appointments, and they see their parent getting a tooth taken out and squealing and clenching and crying, that's traumatic. That's indirectly traumatic for the child. So it's just how we are facilitating these experiences, I think, really make a difference too. Dr. Clark, what do you think?
Yeah, I agree with everything that you said. And just speaking from the experiences at St. Elizabeth's, it was a little more complicated than patients having a bad experience when they were younger. It was experiences of just people, violating their personal space. So it had almost nothing to do with dentistry. It was just the fact that anytime someone was approaching them or invading their space, it was to do harm. So that's why I bring it back to the trust of even beyond dentistry, any doctor, physician that you visit, just making sure that, they're just a person that you can trust. And that trust goes across, any and every industry. You want to make sure the person preparing your food, you can trust, the company that's doing that, or, just trust to me is a big thing, allowing to set that foundation to then begin to actually treat the patient.
I will say more and more, I think more and more of us are getting dental care, are doing more self-care, are starting to understand the necessity, because it winds up turning into another issue. So that's good. But I think if we can, we have some work on a dental side to do with increasing access and making it more affordable and still having quality care. In that regard, I think that will go a long way too. So it's a little complicated, but we'll get there.
Yeah, there definitely has been some exciting things that have been going on. Dr. Millender and I have started our practice green dentistry.
Yes.
Ooh. Repeat that again. Repeat the name of it again and where it is.
Yes, the name is Green Dentistry, and we're currently practicing at 8611 2nd Avenue in Silver Spring, Maryland. So yeah, we're super excited about, just beginning for one, and to really, some of these things that we've talked about, put it into practice, because a lot of what we've seen hasn't necessarily been on par with the way that we viewed the practice of dentistry. So we're just super excited to, come together on that venture there.
That's an exciting thing. And you guys are incorporating CBD treatments as well within your dentistry?
Well, we want to. We still have case studies that there's a process.
I'm sorry, it might be against the law right now. My bad.
Look, girl, I bring my own. Don't worry.
Well, Dr. Clark and I are both medical cannabis providers in the state of Maryland, meaning that we can recommend cannabis to patients who suffer with qualifying disorders. So some of our patients who suffer from those type of disorders, we can recommend medical cannabis for, give them a card, let them go to the dispensary. We educate on that too. But we have read some research, mostly outside of the United States. United States is pretty slow when it comes to cannabis. But if you look at Israel or New Zealand, other states other countries in Europe, they have some pretty sophisticated research that's showing that cannabis can help reduce periodontal disease, which is the breakdown of bone, because it's an anti-inflammatory. So it helps with stopping, with preventing some of that breakdown. Now that was a rat study, so it's still, still not in humans yet, but it's very promising. And then also just CBD's potential to reduce anxiety is so big for our profession. So, one day we hope that we can have a patient come into our office, vape a CBD, we not necessarily THC because the verdict is still out on that. And that actually has other impacts that not all of them are good. But do that, relax themselves and have their dental treatment and go home and say, wow, that wasn't bad, So we're really big on that. Dr. Clark, do you have our, so we just started our business. So we're still getting a lot of things together. Do you have our phone number that you want to put out?
We're still undergoing that process of getting a official phone number, but you can,
or email.
Yeah, you can take down our email, which is info at Green Dentistry. So green like the color, GREEN, dentistry, DENTISTRY @gmail.com.
That's awesome. Congratulations. And Silver Spring is oh, y'all little fancy. Y'all fancy. So that means everybody, for those who don't know, they're in a good office and area.
we're in a nice office with a wonderful mentor. And just to reiterate, that's info.greendentistry@gmail.com. I think you said @, so just in case.
Info.greendentistry.
Awesome.
See y'all.
And we work on a weekend.
Dr. Dee, what say you?
I think I just want to encourage people to look at their behaviors around their oral care, look at their behaviors around self-care, and challenge themselves to pick one thing that they're going to improve on this year. And so maybe it's actually that they haven't gone for a checkup to the dentist in 2 or 3 years or more. So they're going to set a month, I'm going to give myself 2 months to psych myself up, to calm myself down, and I'm going to go get my first oral checkup. But we're worth it. It's just a change in our thinking. It's just a change in our behavior, but it's critically important. We feel good when we leave the dentist, no matter how scared you were to go in. When you leave, you're like, so we have to remember that just get over the fear to change our behavior, change our thinking, because the end result is worth it.
Yes, most definitely. Thank you, Doc.
Star, what's your thoughts?
Well, I'm definitely coming to see y'all. Y'all next
Hey, hey, we'll be there.
we going to get Dr. Marshall to y'all do my teeth right. Okay, so I got two things as always. So I'm gonna piggyback the first thing on Dr. Royster, where you said about, we basically normalizing wellness, right? Like, so, but I saw something the other day that said normalize luxury. And I think of that in the terms of like health and wellness. So I'm gonna start focusing the rest of the year, at least for me, on normalizing like my own personal wellness and prioritizing taking care of like all of me. That includes my teeth. So I will be going to come see y'all at Green Dentistry very shortly. And then the second thing is like communicating our needs. So I really love how you guys illustrated about, when you go to the dentist, you need to tell them the things that are going on with you, not just the script of, oh, I haven't been to the dentist in a year or 2 years, whatever. But like, no, this is what's going on with me. I don't do this. I don't floss. I don't whatever. And I just smoked a joint in my car before I
Definitely helpful.
Because like I literally had no idea that THC can like counteract the anesthesia. And I'm thinking like, okay, I'm getting myself right. And I might be making it worse. So
the more we know.
Like,
The more we know.
The other day, and the lady said, well, you drink a lot of coffee. So she told me, she was like, hey, every time you drink a cup of coffee, you need to drink a glass of water because you basically keep an acid on your teeth all day until you brush or rinse. And I was like, what? I'm 41 years old and I just learned that.
Mm-hmm.
Yeah.
So,
I guess to close, I would
too late to be educated, though.
Absolutely. I think to close out, I just say, Star took my last one in being informed, but I think to piggyback on that, learning that you can take control over saying what you need in the office. So that's something like when I'm at the doctor's office and they try to I remember being in a doctor's office one time, she tried to tell me that what I was feeling wasn't the case, but I know how I feel, right? And I was like, no, there's something wrong. And I ended up having pneumonia. And, but I'm arguing with this other type of, one of us, and you're telling me that I'm not sick. And so if I had listened to that and not gone with how I felt, my circumstances could have been differently. And so I think like for dentistry, it's okay to do the same thing. And I really didn't know that. Like, it seems maybe stupid, but I honestly was like, well, I mean, the dentist is different. You can't really I know if my tooth hurt, but I don't know if I could tell you that, no, like, this is what I'm experiencing emotionally. What can you do to help me with that? Like, I didn't know that. So I think that's a great thing to know. And then just to encourage, like Star said, like our wellness has to include everything in our body, not just certain things, or not just when something hurts, not when, like I called the dentist the other day because I'm like, I think I got a cavity, but that's about the only time I call sometimes. So, certain instances like that, we really do have to do a better job and prioritize on that. So, with that said, we appreciate you ladies. Thank you so much. We learned a lot today.
Amazing.
And we out.
Hey.
Right.